It's flu season for both yourself and your dog. Here, Dr. Langlois provides an update on a new strain of canine flu that is kind of sweeping across the nation.
Hello again, everybody. This is Dr. Langlois, the Pet Pantry of Lancaster County, coming to you with your pet health tip of the day. And this one is actually a little bit of an update of a previous pet health tip I had given a little while ago about the canine flu. And you may have noticed in the media a little bit lately or in some news reports that you've seen more information being talked about as far as canine influenza or dog flu as it's caused. And I just wanted to give everybody a little bit of an update as to where we stand and the new vaccine that's out there and whether you should get it and things to be worried about. So as I kind of let you all know about a little while ago, when we first noticed the dog flu creeping up, it happened in the Chicago area, and it was a new strain of dog flu. The dog flu that we were originally dealing with, canine influenza, was a strain that was labeled as H3N8. Don't worry about what those letters and numbers mean, it's just the way that we type flu viruses. And this had crept up about 10, almost 15 years ago now, and run its course through the country. There was a vaccine that we noticed for it. It was causing a lot of problems in the shelters and the boarding kennels and the greyhound racetracks, and as well as family pets, is true. And this new strain was a strain that was present in Asia. We had known about it. It's an H3N2 strain. And we're not exactly sure how it got over to the U.S. More than likely, with everybody, traveling a lot more, and especially traveling with their pets a lot more nowadays, we do believe that's probably how it transferred over. Just, the way a human flu virus spans the globe through people traveling, it's not that uncommon to see a dog flu virus do the same, basically. So we did start to see this new strain, as I said, pop up in the Chicago Midwest area, and it seemed to be concentrated there for a long period of time, and maybe a couple of states around it. But as you can see by the map that's over my shoulder right now, this dog flu, the H3N2, is starting to really spread out throughout the country. And if you remember when I talked to you guys about this last time, this is pretty much what we expected to happen. We didn't want to cause a panic. We didn't want to say it's the next pandemic or major thing to be worried about, or the apocalypse or anything like that. This followed very much the pattern that the original H3N8 strain followed, which was showing up in pockets and then slowly spreading from state to state, because basically all of the dogs are naive to this infection, and basically what that means is they don't have any natural immunity. This is a totally new virus. Up until a little bit recently, there was no vaccine that was out for it, so every dog is susceptible. The only way they can get protection is through vaccine, which I'll talk about in a second, or through getting it and then recovering and having natural immunity themselves. And that to develop that kind of natural endemic immunity throughout the populations takes years of dogs getting vaccinated and then breeding and reproducing puppies that have natural immunity, all of that stuff, as well as good vaccination programs. So the next question that usually comes up with it is, well, is this worse, than the original one? Should I really be concerned? And from a scientific standpoint and veterinary standpoint, it does appear that this strain is a little bit more virulent, which basically means that it does seem to cause a little bit more severe signs and can, cause maybe a touch more death in dogs than we were seeing with the original strain. Now, when I say a touch more, I'm not talking, like under 1% death up to 50% death. No. Maybe 5% of dogs that are infected will succumb to this, or a little bit less. That's kind of the percentages that we're seeing with the reports coming in from the vets that are treating this. And if you think about it from human terms, that's pretty common with a flu virus. If you think about people, how many thousands of people die every year, unfortunately, from being infected with the flu. And in most cases of these, unfortunate deaths that we're seeing, it is in animals that maybe have underlying conditions or are much older and are very, very young and have a little bit more trouble fighting off infection. So it's not the case of, where a big, strong, robust, healthy dog is automatically going to, be killed because of this virus. That's just not the case. But it is something we do want people to be very aware of, because the only way to really get, good treatment for your dog if they are infected with it is through your veterinarian. So if you suspect any signs of potential canine influenza in your dog, and they can very well mimic normal, kennel cough signs. So a little bit of coughing, maybe a little bit of discharge coming from the nose, a little bit more rapid breathing, things like that. Usually they describe the cough as a honking type of cough. Maybe they're down and depressed for a little bit. You definitely want to let your vet know and have them examined at least to make sure that if treatment does need to be initiated, it can be fairly quickly. Sometimes these infections can spread down into the lung areas where they cause basically some damage in the lung tissue to allow secondary bacterial infections to take hold. And that's where we get concerned, because that's when we start getting the really bad pneumonias in dogs that require maybe on oxygen therapy, as well as some pretty strong antibiotic therapy and hospitalization to take care of and treat. So you definitely want to make your vet aware if you notice any signs that might be going on. Another question that pops up is, well, is this flu going to be something that, transfers over to people? And, just like the bird flu or the pig flu, or are we going to have to start worrying about the dog flu now being the next, killer of man? Will man's best friend actually kill man through the flu virus? And the answer is basically no. We have not seen any cases of this virus jumping over to humans and causing any problems or infections. And you can check constantly if you wanted to the CDC website, cdc.gov. They have a whole section on canine flu, and they will show that there have been no reported cases of either the H3N8 or the H3N2 jumping over to people and causing any issues or anything like that. So, you don't have to worry about it. Man's best friend is still going to be man's best friend, and no, you don't have to worry about getting sick from your dog or anything like that. So, the next question that usually pops up, and what I'm going to focus mostly on, is vaccination. And is there a protection against this? And the answer is yes, there is. There's a new vaccine that just recently came on the market that basically protects against the H3N2 strain. Another question that then gets asked is, well, does the old vaccine, the H3N8, cause any protection against H3N2? It does not appear that that's the case. And anybody who's familiar with the flu vaccine that comes through every year, they report there is maybe a little bit of cross protection in the human flu vaccines, but if it's a totally different strain, the human flu vaccine may not work. And that's sort of what's happening here in the dog. So you do actually have to get your dog vaccinated for the H3N2, and it is something that we definitely do recommend getting at your veterinarian. You can get both vaccines, the H3N8 and the H3N2, at the same time. There's no danger of doing that. However, for any vaccination protocol, you definitely want to talk to your vet about maybe potentially splitting the vaccines, especially if your dog is one that happens to maybe react a little bit more to vaccines or things like that. So the other final thing I wanted to talk about was another type of vaccine that's an intranasal vaccine for just general, what we call kennel cough complex. And you have to remember, there's tons of things that cause the basic kind of cold symptoms we see in dogs or kennel cough in dogs. The list over my shoulder here demonstrates that. There's tons of them. There's not just one agent that causes kennel cough. And that's why it's so important to talk to your vet about the signs you're seeing in your dog to make sure that you're not jumping to a canine influenza diagnosis because it's in the news, when actually they're just infected with a basic Bordetella or bacterial infection that just requires some antibiotics. So that's why, again, it's always important to talk to your vet about these things. The one vaccine I am going to talk about, it's an intranasal for kennel cough, and it's commonly called the Bordetella vaccine because that's the most common bacterial element that we find. But there's another element called canine para-influenza, and it's not in any way, shape, or form the same thing as canine influenza. They're totally different viruses. However, para-influenza has been implicated in a lot of kennel cough type symptoms and disease in dogs. And we find that while it is available in the injectable form that usually comes with the distemper combo vaccine that you get your dog, the better protection is actually given through an intranasal form. So you want to talk to your vet about getting what they call the 3-in-1 or the 3-way Bordetella intranasal vaccine. That will provide the best protection from your dog and prevent a lot of co-infections with other elements as well. So if your dog is infected with canine influenza, hopefully that's the only thing, and you don't have to worry about a lot of these other possible infections just compounding and making things a lot worse. So, to kind of recap, you want to make sure that you talk to your vet about getting those canine influenza vaccines, as well as the 3-in-1 intranasal Bordetella vaccine. That is really probably the best one that's out there to get. And again, if you have any questions, talk to your vet. Know that H3N2 canine influenza, it's here to stay. It's going to spread throughout the entire country, but it is not a reason to panic. It is something we expected. It's something we're basically prepared for. And the best way to protect your dog is to talk to your veterinarian about getting the most up-to-date information and the vaccine that is necessary for it. So if you have any questions, again, about this, because the information is always changing a little bit, contact your veterinarian. Don't rely so much on the internet unless it's a reputable site that is done by veterinarians. And that is your Canine Flu Update Pet Health Tip of the Day.
If you happen to suspect that your dog may be infected with the canine flu, it's really important that you have them seen by your veterinarian immediately. For more information on the canine flu and any updates, be sure to visit some of these websites, or even better yet, contact your local vet for the most up-to-date and accurate information.